autoimmune disorder that causes the thyroid gland to overreact. Autoimmune disorders are when the body's own immune system attacks its own cells rather than protecting them. With Graves' disease, the body's immune system makes abnormal chemicals called immunoglobulins, which stimulate the thyroid gland, causing it to produce too many thyroid hormones. Symptoms of Graves' disease varies from person to person, but can include weight loss without a diet change, an increased amount of sweating, nervousness, hand tremors, anxiety, irritability, irregular heartbeat, and heart failure. Simple blood work and a radioactive uptake scan can be performed to diagnose a patient with Graves' disease. As a result of Graves' disease being an autoimmune disorder, every patient will react differently, as well as acquire the disease differently. Poor digestive system health is commonly associated with autoimmune diseases. Food allergies, especially gluten, can cause hyperthyroidism. People who have a family history of Graves' disease are more susceptible to the disease. Women are more likely than men, and the disease usually develops in people under 40 years of age. Graves' disease can be treated in a variety of invasive ways, such as through a thyroidectomy, which is when the patient's thyroid is removed through surgery. All their thyroid functions will then be artificially ingested through medication. Radioactive iodine can also be used. A patient will take a pill, causing the thyroid to shrink and eventually lead to destruction of the gland. Rather than performing harmful invasive therapies and surgeries, a lifestyle change of diet can significantly help the patient. Low iodine diets have been proven to lower thyroid hormones. For a low iodine diet, it is recommended not to consume iodized salt, dairy products, seafoods, limited grains, and a limited amount of beef, chicken, and turkey. It is also recommended that patients with Graves' disease avoid dining out because there is no reasonable way to determine which restaurants use iodized salt. For the rest of my project, I plan to provide studies that studied the impact of iodized salt on people with Graves' disease. I then want to interview 3 different people with Graves' disease and put the interview clips into my video. My mom and best friend both have Graves, so I want to interview them. I then want to take pictures of foods I've made at home that are low iodine. And in the conclusion, I want to talk about the big pictures. So for access regarding Graves' disease, access to diagnosis, access to medication, and educational and lifestyle changes. And then for the conclusion of lifestyle medicine, how simple change can greatly impact one's health, and learning about what your body needs.